All right, friends. Hi. You asked for a video, so here is the video. Um, First off, you may hear some squawking. Put Ziggy to bed, but he isn't going to rest. So, sorry about that. Hopefully, he'll calm down in a little bit here. May have to put him in another room. We'll see. Second of all, I don't really have good equipment. I don't have any audio equipment whatsoever. So I'm filming this on my webcam, and the quality is meh. And because I don't have audio, I have to do it through that so I can get some sort of audio. So please bear with me. Hopefully this will still be worth the while. And here we go. All right, so hi, I'm Rachel, and I'm a detransitioned woman. What does that mean? What does it mean? Well, about 2012, I decided that I was transgender. It was a very difficult thing to come to terms with at the time. However, looking back, I can see I was influenced by a lot of other things. And so, hindsight's 2020. Now I'm able to process a lot of things that I wasn't able to process at the time. So that being said, 2012, I started hormone replacement therapy, HRT. I injected myself with testosterone weekly, once weekly. And many people use an injectable depot shot testosterone. Other people use a patch. There's also, I think, a subdermal thing that releases testosterone into your system a different way. My main method, and there's also the gel. My main method was the injectable, although I did try the gel for a short while, but it just didn't have that kick. So I'm gonna just, forewarning, I use a lot of comedy, mostly awkward comedy that doesn't land, to kind of deal with the dark shit. I have a really hard time with dealing with the dark things that I've experienced and the kind of just conundrum that was transition in general. So I apologize if I make any comments or jokes that maybe seem offensive. Really, it's all in the spirit of smiling and laughing through the pain. If I make a joke, it's purely about my own experience. I'm not laughing at anyone else who's gone through any sort of issue with any of this, but it's how I cope. So that being said, I stuck myself in my rear end once a week with testosterone injections. And how I got there was pretty fast. Even looking back now, I can't believe it got done so quickly. I mean, I can in the time that we're in. But at the time that I started back in, again, 2012, which really wasn't that long ago, it actually was a little bit of a different process than how it is now. So at the time, in the state that I was living in, it was a requirement that you have a formal letter signed by a therapist as well as a formal letter signed by a doctor. And those could be the same letter, but signed by both parties, indicating that you had lived as your desired sex for a period of time. Now, if I recall correctly, I believe for me it was living as desired sex for 6 months, but I may be wrong about that. It's hard for me to recall. At the time, I had only been presenting male, again, whatever the hell that means. I'd only been presenting as male for about 3 months, and really not making much effort, to be truthful. I was very adamant with my friends about calling me he, him, and all this, but I hadn't come out to my family at all. I hadn't gone through a name change process. I hadn't told my employer about any of that. So it was all still very fresh when I started seeing a gender therapist. Now, a gender therapist is someone that you might seek out if you are questioning your gender, if you are within the LGBT community at all, or if you're just outside, again, questioning, curious. You might seek out someone who has specific qualifications in regards to gender identity. Now, that is, in a way, I believe, somewhat problematic because you're not getting an unbiased perspective in that field. You're getting someone who, for their, for whether they intend to or not, they are so saturated with the ideology surrounding gender identity, and they have kind of been trained to speak to certain terms and to guide you in a very specific path, that I personally believe that seeking out a gender therapist versus a regular therapist or psychiatrist, someone with more of a medical background, I believe that a gender therapist is kind of, you're guaranteeing that you're going to come out of it with a certain diagnosis along the lines of what you're looking for. That being said, I can't speak to all gender therapists. I can only speak to my own experience, right? So my gender therapist, I'm going to do my best here not to throw her under the bus. I'm going to do my best not to throw shade. I get a lot of comments from people saying I should sue her, I should get her fired, I should let her know that she's just the worst ever. It's complicated, guys. So I want to give her some benefit of the doubt in the fact that she's working in a field where, again, she's been saturated with this ideology. It's her choice to be in that field. However, I think she fully believes that she's doing the right thing. And, obviously the path to hell is paved with good intentions. But as far as my communication with her since all of this started, I have not communicated with her, and that's on my end. For a lot of reasons. I have not reached out. So bear in mind that any critique I have of her, she's not going to change until me and people like me speak up. And there's a lot of complicated things surrounding us being able to speak up. A lot of times when people detransition and we speak out to our previous doctors and therapists, we get backlash and we get rejected, or we even get told that, you were a mistake. You're just, oops. So that's a part of it. That's not the entirety of why I have not reached out to her. Again, it's complicated. I'm not going to get into it right now. But I just wanted to kind of head that off, that I would appreciate if people not completely derail her. You know what I mean? This isn't just one person's fault. This isn't just one person's choice. This isn't just one person's actions. There were a lot of moving pieces. That being said, let's get into it. So, my doctor, or rather my therapist, she had claimed to have a lot of experience with young LGBT people. So that's supposedly including mostly young adults and teenagers. She did work a lot with teenagers, and I don't recall many, if any, people over the age of 40 seeing her. And I was fairly involved in her clinic as time went on. So she had this experience, and I sought her out after claiming to be transgender. I was referred to her by a previous client of hers, who was actually the person who first indicated that I might be trans. Now, looking back, it's really frustrating to me to see myself in the past being so heavily influenced by other people and their opinions. Um, and I wish that I had not been naive, and I wish that I had not been so susceptible to other people. But I can't change that now for the past. All I can do is change that for the future, and think more of myself and think more critically and give myself the responsibility of making decisions instead of letting other people kind of decide which way I go. So, this person referred me after, and this person was a transgender identified male, so a trans woman. And this person, yeah, Ziggy. This person referred me after after they had seen my therapist for I think a year. They'd been in a relationship, and so I entered into this clinic without really knowing what gender therapy was. Like many people who come into this, you're kind of just told the basics of your brain is a certain sex, and it's not in flux with your body. It's not working right with the body that it's in. But I didn't have any idea as to any of the rest of it. I didn't really understand hormone therapy or surgeries or any of that. So I started seeing the therapist kind of just wanting to get more information and to realize what the next steps were. I'd seen plenty of videos. I was not a Tumblr participant, still not. More power to you, I guess, trudging along with that. But I had watched a lot of YouTube videos about transgender identified females or trans men who were on testosterone. And I thought, that looks good. I think that's what I need. So when I entered the clinic, I did kind of have a little bit of a notion for what I wanted, but I had no idea how it worked. So in seeing the therapist, we talked for a little bit, and I did mention to her that I have a history of sexual abuse. Starting from when I was age 4, I was sexually abused by my father, and then went on to be sexually abused by other people, and furthermore was had a number of rapes and sexual assaults. And I did bring this up to her and told her, a lot of my feelings about my body are that I don't have control over it. An error on her part is that she did not recognize this and she did not acknowledge it, even though I brought it up to her. A lot of women who go into therapy with body dysmorphia or dysphoria or issues surrounding self-esteem and their bodies, a lot of those women have had previous abuse. It's really not to say all, but I think that there is a very serious lack of acknowledgement in the psychological community for women who have had these issues, and then the later effects of that abuse. There's not really much effort, I think, in understanding how abuse affects women long term. And that's something that I'm very passionate about and very angry about, because I feel like a lot of my mental health issues could have been better taken care of if people had simply acknowledged that there was a link between what was done to me and the feelings that I had around my body. So I'm very disappointed that she did not acknowledge that at the time, particularly because I brought it up to her and pointed it out. It's reasonable to say that not every woman who's been abused will have the capacity to point out, hey, this happened to me and I feel this way. A lot of times it will be jumbled and confusing, and the feelings don't necessarily feel like they originate from somewhere. They're just there. And usually they're overwhelming. So to be able to point that out, I think, is very important. And it's okay to acknowledge if those feelings are overpowering you. It's okay to acknowledge that what was done to you makes you feel a certain way about your body that you don't want to feel and that you know is not normal. Admitting that isn't giving it more power. Admitting that is looking at the origins of your feelings and saying, this is where I need to start. So, because I did not have that opportunity with this therapist, she did offer up some acknowledgement that it's possible that I was like internally homophobic. And what that means to me, I know there's been a little bit of debate about internalized homophobia and if it's like a phrase that's overused. It probably is. I mean, all of these terms that we have, they had meaning at one point and now they're kind of dissipating into nothing, right? Because we just use them and use them and use them. But I do still use this phrase because for me, the homophobia that I grew up with, I grew up in a very religious household, and the homophobia that I was surrounded with, I feel I started to turn in onto myself, and I used it as sort of a rule for comparison of if I meet these qualifications, I might be too close to homosexuality, and that's a bad thing. So that's where I'm coming from when I say internalized homophobia. I did have a fear of being a lesbian. It was something that I thought meant I was going to be alone forever and unhappy, and that people would not want to be around me because of it. So it's something that I was afraid of. So clearing that up. She did mention that she thought maybe there was some internalized homophobia there. And I definitely had some other mental health issues that she kind of brought up occasionally, but didn't really put effort into focalizing. Like, it was sort of like peripheral. Like, my mental health issues were because I was transgender, not the other way around, and not separate. It was very much, you're trans, and that's why you have all of the depression and anxiety and things like that. It wasn't, well, maybe these two things are linked in different ways, if that makes sense. So, unfortunately, that process with her was very short. She and I talked a bit, and as I talked with her, I also started going to a group event for young transgender people, young adults, and I think that was kind of the nail in the coffin, so to say, because I started to, again, become more influenced by my peers than allow myself to hold the responsibility of critical thinking. Instead of thinking for myself, I got absorbed in the experiences of the people that I was around. And I could relate to them too, and they could relate to me. And it's really hard to separate that developing relationship um, with those people, and to separate that from the decisions that you need to make for yourself. So that's a really key thing that I would suggest for anyone who's questioning their gender or considering going down the path of being transgender. Stop for a minute and think, what would your decisions be if you never knew the trans people that you know? What would your decisions be if you never saw that video, read that Tumblr blog, talked to those people at your school? What would your decision be? What really innately feels right? Because I think it's really difficult to connect with people and not start to take on their qualities, especially when you're in a vulnerable state where you are acknowledging things about yourself that you're uncomfortable with. It's a lot easier to find community and latch on to that than it is to say, no, I need to go my own route. But it's important that you make that choice yourself. So I went to these group meetings and got very involved. And it was a sort of peer counseling group, which between us, I think is totally unethical now. I mean, for things like AA, that's great, and it works for some people. For things like this that involve more of a medical procedure later on down the road, there's too much room for risk. I don't think that it's good to get all these people together, influencing each other, and expect them to be able to really help each other and advertise it. I should say, and advertise it and emphasize it as a method of therapy. If you want to get together with friends and, commune that way, absolutely. That's so important to do in any kind of setting for any kind of community. But when you're advertising it as like kind of a supplement for other therapies, that's where the danger is, I think, because these people are not qualified. They're your friends, but they're not qualified. So going to this group therapy, peer therapy, I got really close with some people. In fact, one of the people there who was a transgender identified man, we became close and eventually dated. That person now identifies as a transgender woman. And I still care very much about that person, as well as a lot of the other people that I've stayed connected to from the group. I do genuinely love and care about them still, no matter their choices, because they're adults. They get to make their own choices at the end of the day. Sorry, gotta stay caffeinated, or else I can't talk this fast. So I got very close with these people, and over the period of I think it was a few months, maybe a month and a half, 2 months, I got the letter. Now, if you're in the trans community, you know what the letter is. Even if you are brand spanking new and you don't have to have a letter, I'm sure you've heard about having to have the letter. And it's a big deal, and people go crazy for it. So I got the letter, and it just so happened that the therapist I was seeing had a partnership with a medical physician who prescribed hormone therapy. One and done, right? Two for cool. Again with the joking. Really, that was quite dangerous. Because essentially what happened was my therapist wrote up a letter. Most of it was misrepresentation of our relationship, indicating that I'd been seeing her a lot longer than I had been, indicating that I'd been living as my preferred sex for longer than I had been. All these things in the letter that were untrue or exaggerated. And my therapist signed off on it, faxed it over to the doctor signed it off, and in one day, I had everybody's signature that I needed to get hormone therapy. Hormone therapy is not a cure, and it is not an easy thing. Hormone therapy is a serious medication. Hormone therapy is a restricted medication for a reason. Going on hormone therapy changes your entire chemistry. And while some people are in a place where they feel like that's necessary, you deserve to take time to really consider the physical conditions that you're going to be putting your body through. Because every single body is different. Every single body processes hormones differently. And it's kind of a gamble. Like, even today, like, I was taking them back in 2012 when they would just straight up be like, we don't know what this will do to you. It'll probably make you bald and give you facial hair and deepen your voice, but it also might kill you. Who knows? Not quite that extreme, but, you know, like, there were things that just were unknown. And still today, it's unknown. It's untested. Maybe I'm wrong, and please, like, commentators, reach out to me, and let me know if I am mistaken on this, but I don't believe there has been a long-term study done, even today, on the effects of testosterone on female bodies. Again, please correct me if I'm wrong, because I would love that information. In any case, at the time I was taking it, or at the time I started it, there had not been any long-term studies done. And my doctor was pretty upfront about that, but didn't see it as a bad thing. She didn't see that as a concern whatsoever. She straight up told me, yeah, we don't really know what it does to you after a couple of years. You'll probably need a hysterectomy eventually, but you'll be good on it for a while. So if your doctor doesn't know the effects of a drug, then you need to do a lot of your own research at that point if you're going to stay with that doctor, because otherwise you're both going in blind, and that's not okay to do with any medication, particularly something like this that could affect your thyroid. It could affect your kidneys and your liver. It can affect your heart. It can cause serious problems if not done correctly. So I'm not saying yes, take it, or don't take it. I'm saying if you choose to go down that path, please, I implore you, do a lot of research. Don't listen to your friends. Don't listen to the community. Don't just go in blindly. Seriously, do research on the drug. Do research on the depo-testosterone or whatever it is you're doing, because this medication is very serious. So, that's my little demand there. Sorry, I get real passionate about this. All fired up. So, yeah, my doctor, she started me on injectable testosterone. I started off on 40 milliliters. I think I think it was a 1.5 shot. I can't be too specific, honestly. It was a long time ago for me, so I don't quite remember. And I apologize, I can't be more clear. In any case, later on, I would discover, as I was nearing detransition and started to question the medical side of what I was doing, I learned that I had been prescribed what is usually 2 to 3 times the dose that female people are given, especially female people of my size. I bolted in to changes, lots of changes. And it was really scary. A lot of detransitioners, not all, but a lot of detransitioners talk about having moments of doubt in the process, and mine started pretty much right away. While I got somewhat of a high from the shot itself, because you're getting an adrenaline rush, and then there's also the kind of psychological aspects that's tied to it. You feel very like pumped up, and you feel really good for a little bit, and then you crash pretty hard. But aside from those aspects, the changes that were going on with my body, they scared the shit out of me. After I think about 2 weeks, my voice was already dropping really low. I was already starting to get facial hair. I was losing hair. After like a month, I started losing like a ton of hair. And that was really scary. So after like a few weeks, when changes really started, like bam, I saw my therapist and I told her, like, this is really scaring me. I don't recognize myself. I don't like what I'm seeing. Feel I don't feel myself in my body. Even more so, I thought this was supposed to make it better, and it's not. It's making it worse. And I'm gonna get emotional here. And she told me that's normal and that's part of the process, and it's not. Okay. If you are seeing these changes happen and you are feeling more separated from yourself, that's a sign that you need to listen to. It doesn't mean stop, and I'm not telling you that that's the end all be all. Nothing I say will ever be an all-encompassing qualification or disqualification of your choices. You make your choices. But I will say, please listen to your body and to your mind when you are hearing those signs come up. For me, I felt so out of control, and she told me it was normal, and she told me I was just gonna feel better and better over time, and it would go away. And that's irresponsible, and that's not true. Because it didn't go away. It continued to get worse. And I continued to do it, holding out hope that at some point I would reach this level where I was comfortable in my body. And that didn't happen. So I was on testosterone, and my doctor at the time, I had to really push her to do blood work, which is another indicator that maybe you don't have the best physician and you should consider a second opinion. My doctor did not take blood work seriously, and did not take levels very frequently at all. And it was also difficult for me because I was on state insurance at the time, so every time I had to get a lab visit, it was very costly, and I had to like make an appointment with my doctor to then make the appointment for the lab work. which for other lab testings I've done has not been the case. So maybe that is the normal procedure. I'm not a doctor, so I don't know. However, that kind of created a hurdle for me because it was like I couldn't get lab work done that I knew I needed done without physically seeing my doctor first, just to chat, basically. So I would pay for a chat, and then I'd have to go pay for the lab work. And now I think things are a lot more streamlined anyway, just with like televisits and online e-care type of things. But I don't know. In any case, that was a part of the struggle for me, was getting all of my my hormone levels tested, as well as my blood work to check, make sure that my organs were still functioning, was a struggle. And if anything, she should have been pushing me like more and more for it, especially as I increased dosage. I know there were a number of times where she increased my dosage without taking any levels. You don't do that. And the reason you don't do that is because you need a base. So you need a base before you start any hormone therapy whatsoever. You need to know what your hormone levels are, as well as what your organs look like. And that's your kidneys, your liver. You need to make sure your patient, doesn't have any underlying blood pressure issues or risk of stroke or heart attack, because those things are heightened with use of testosterone. So you get that baseline. Then with every higher dosage after you've prescribed the first one, you need to reevaluate that baseline. And she just wasn't doing it. So I was kind of flying in the dark, just like, all right, well, I hope my body is not totally screwed, because I can't do this myself. I can't just go and get the lab work, because again, I have to see the doctor first. And there were times where she even told me, like, no, you don't need that done. You don't need to get it done. I'm not going to send you a referral to the lab. Again, irresponsible. So I was on testosterone and wasn't feeling good about it. My therapist and my doctor pressured me a lot to work on the road to surgery. In fact, that's the main reason why I stopped seeing my doctor, was because she told me at one point she was going to stop refilling my prescriptions until I got an appointment with a surgeon to consider top surgery. Now, how do I put this delicately? I would never need top surgery, even if I never wanted to bind. I got nothing going on here. And I know for a lot of people, it's less about the quantity of fat distribution, and it's more about feeling more masculine in your body, and feeling like you can go to the beach or take your shirt off, and people aren't going to notice the difference. But for me, I had no issues with that part of my body, really. I should restate that. So my physical body issues that I had were, I was uncomfortable in my body because I didn't like walking around and being noticed for my body. So I wanted to change because I didn't want to be seen as female, because of the attention that females get. I also wasn't comfortable sexually with men, only with men, being touched in certain ways on my body. Now, looking back, I feel kind of stupid. But at the time, I was like, well, surely this has to be, a part of gender dysphoria. This isn't just me being a big old lessie. But in any case, my therapist was kind of more encouraging of the fact that, well, no, that's gender dysphoria, and that means you need to go down this route, and you eventually will probably want surgery. The only surgery I really thought I would consider at the time was a hysterectomy. And that was because I wanted to lower my testosterone dosage. I became, early on, I was concerned about the effects of testosterone on my body, not only because it made me so uncomfortable in my own skin, but also because I knew there hadn't been a lot of long-term research done. So I was concerned about that. And I thought if I have a hysterectomy, like a total hysterectomy, and remove the ovaries, that will negate the need for a higher dose of testosterone because I won't be combating estrogen. So that was my thinking. Now that I've actually had a hysterectomy, which if you do or do not know, I had endometriosis. And so after a previous surgery, it came back and my specialist suggested a hysterectomy would be the best option. So that's why I've had a hysterectomy. It's not related to being transgender. But since I've actually had a hysterectomy, I'm actually now incredibly sad about it. And I'm glad that I put that off, at least for as long as I did, and got it for the reason that I did, which was to alleviate pain and stop disease from spreading, versus wanting to continue on testosterone. But that's just my journey. So that was the only surgery that I was considering. I did not want phalloplasty. I did not want top surgery. I didn't want any of that business because I felt like I didn't need it. And really, the main thing for me was I wanted to be able to walk down the street and not be harassed. That was pretty much my main motivation for this whole thing. And again, looking back, I feel very sad for the person that I was, thinking that this was the only option, and thinking that I had to not be a woman in order to be treated right. Yeah, it makes me really sad. And I think that there are a lot of women out there who feel similarly, or have felt similarly. And it can lead to some very permanent choices. I'm glad that I did not have surgery. That being said, detransitioned women who have had surgeries, some very intrusive surgeries, they do exist, and those women are amazing, and they are my sisters, and I care very much about them, and am grateful to them for sharing their stories. But I am not a detransitioned woman who has had surgery. So back to it. Testosterone. It's a hell of a drug. What can I say? This video is getting a little long, so I'm gonna wrap things up here. I will make another video, I think, sometime soon, and continue talking about my journey physically with testosterone and transition. I may also make a video talking a little bit more about my past in regards to sexual abuse and the kind of environment that I grew up in. It was really weird. It was really weird, guys. I mean, aside from the horrible things, it was just generally really weird. So it's kind of hard to explain just like in a few sentences, like what it was like. So maybe I'll make a separate video talking about that, because maybe that would interest you. I don't know. It definitely played a part in why I had very strict gender roles in my head and why I went down the path of thinking I was transgender. But anyway, again, I apologize for Mr. Squawky. Of course, now he's finally calmed down. But thank you for watching. my heart goes out to anyone out there who is considering detransitioning or desisting. If you are struggling with deciding if transition is the right choice for you, again, first and foremost, I would really implore you to listen to yourself first. You are making a choice about yourself, and you are the only person who's going to have to live with those choices. So please listen to your body, listen to your mind, give it time. You don't need to rush into anything. And know that whatever your choice is, I support you. And apparently my dog is destroying things, so I'm gonna head out. But thank you guys, and catch you on Twitter.